My name is Victor from the Star Events team, and I'm glad to be your host for today's session. Thank you for joining today's Live on Web online seminar on obesity management. The 1-hour session is organized by Star Media Group and education partner Johnson & Johnson. It is streamed live on StarBiz Facebook page, so thank you everyone who's tuning in right now. Do share our StarBiz Facebook Live with any of your colleagues or friends who are keen to join. All right, a few quick housekeeping matters before we begin. As everyone dials into this webinar through different internet bandwidth and devices, you may or may not experience minor technical glitches. So please be patient if there's any. To minimize the risk of technical glitch, all participants are muted, video cam turned off, and chat box disabled by default. But do participate by posting questions to our panel. You may send your questions to our panelists at any time during the session. On your user panel, click on the Q&A button at the bottom of your screen and post your questions there if you're using Zoom, or place it in the comment section if you're watching via FB Live. There will be a short survey at the end, so to those joining on Zoom, please take a few minutes to complete it. Your opinion matters to us. Lastly, and most importantly, please engage, learn, and enjoy. High consumption of energy-dense foods coupled with a lack of physical activity are a contributing factor to the increased obesity and overweight statistics in Malaysia. The prevalence rate of obesity in adults have risen from 17.7% in 2015 to 19.7% in 2019, while prevalence rates for those who are overweight have slightly increased from 30% in 2015 to 30.4% last year. And all this is according to the National Health Survey 2019. This means that half of Malaysian adults as of last year were either overweight or obese. With the increasing number of obesity and its accompanying problems, bariatric surgery has become a very viable option for obese patients, among others. In today's webinar, we hope that we were able to provide you with an understanding on the many options of managing obesity and what it would mean to your quality of life. For this evening's discussion, we have the pleasure of having two renowned and respected surgeons as our speakers, as well as a guest speaker who has undergone a surgery, a journey to tackle obesity. As the moderator today, we are also pleased to have Sheahnee Iman Lee. Sheahnee Lee is a TV personality and professional MC with 2 decades of experience anchoring primetime news, hosting television interviews and national conferences, as well as consulting for large corporations on media strategy and broadcasting. With that, I'd like to hand over to Sheahnee to begin the session.
Thank you, Victor, for the great introduction and laying down the context for tonight's webinar. Now, for the next 1 hour, I hope to learn from our panelists how bariatric surgery as a form of weight management can be an effective option for those who have tried dieting and exercise, but aren't getting the results they need to be healthier and to have a better quality of life. As Victor shared earlier, more than 90% of people lose at least half their excess weight through bariatric surgery, consequently helping to relieve a number of chronic weight-related conditions such as diabetes, cardiovascular diseases, arthritis, and of course, fertility issues. So to help us understand more about bariatric surgery, in a short while, we'll be speaking to Dr. Mustafa Mohammed Taher, who is a consultant upper gastrointestinal and bariatric surgeon. Just a quick background on Dr. Mustafa. He is a graduate of Baghdad University, following which he joined the Iraqi Board of General Surgery as a senior medical officer in general surgery. Now, after acquiring his degree and fellowship of the Iraqi Commission for Medical Specialization in General Surgery, he completed the program of Masters of General Surgery at University Kebangsaan Malaysia before joining Hospital Kebangsaan Malaysia as a specialist in upper GI and bariatric unit in 2012. Thanks for joining us, Dr. Mustafa.
Thank you very much.
Welcome. Then we'll also learn about the dietary and nutritional needs of a bariatric patient from Emcee Fu, clinical dietitian and certified bariatric educator. Now, here's a little bit about Kafu. He's been practicing as a dietitian since 2012 After obtaining his bachelor's degree in nutrition and dietetics from International Medical University, he went on to practice in a multitude of environments, from a corporate dietitian in a sports supplement company, to an academician in a private medical university, to a clinical dietitian in both government hospitals and private medical centers. Kafu went on to receive the Outstanding Clinical Instructor Award from the Malaysian Dietitians Association in 2017. Now, with his growing interest in obesity medicine, Kafu earned scope certification for obesity management by the World Obesity Federation, and is now also a certified bariatric educator conferred by Obesity Canada. Kafu's current areas of practice include bariatric care, obesity management, oncology nutrition, perioperative nutrition care, ostomy nutrition, and nutritional genomics. Whew, that's quite a mouthful. Glad to have you with us, Kafu.
Hi, Sheahnee. Thanks for introduction.
And finally, we'll get to hear from the experiences of a former bariatric surgery patient, Muhammad Hasli Alfie bin Ahmad Sobri, or more famously known as Chef Bob. And we'll find out how bariatric surgery helped change his life. I'm looking forward to hearing all your stories, including yours, Chef. So first up, let's have a chat with Dr. Mustafa. Now, Dr. Mus, in your profession, you've handled lots of cases where diet and exercise were no longer effective options for a patient. Can you share from your experience how you've seen patients benefit from bariatric surgery?
Okay, thank you, Sheahnee, for the great introduction. I feel jealous because Kafu's introduction was longer than mine. Okay, hi everybody. Thanks for all those people who participate in this. Big thanks to Johnson & Johnson to invite me here. I think now is people that are talking about bariatric is the hype, but it's not really the hype. It's been there since 1950s. It's just that I believe now the health awareness, which increased by all levels, including the obesity. Now we are living in a country in Malaysia where you have the obesity of compounded also like 42.3%. You are talking about half of the population. They are obese, and not only that, we went even down and lower than that. We are talking about obesity in adolescent, and even talking about obesity in childhood obesity. How the thing is actually is turned to be like very contagious in the culture. And here is actually where has come the idea of having such webinars and try to educate the people in a way or another. Now, what bariatric it does is basically we need to understand what is bariatric first. This is the concept. Bariatric is another term is actually called weight reduction surgery, and it's not about making your stomach smaller. It's not about try to change the metabolism only. It's actually it's a whole workup of everything. I never had any patient of my patients who come to the ward without seeing Kafu, the dietitian, because it has to be a complete plan. And the subsequent one is called to their lifestyle and exercise and so forth. So now is bariatric surgery, what it does is basically, yes, it does reduce the size of your stomach. Now, people, they said, okay, might as well I just don't eat a lot. But you have to understand that is only one part of it. The main part of it is actually, it's would take out the hormones from the body that cause you all this, which we call it the hunger hormone. So the way how you feel about food, how your satisfaction of food is totally different. That's one. Second thing is actually, it's a whole work for the whole body to adjust whatever been ruined out by the obesity itself. Now, we are not talking about the obesity of people who have 5 or 10 kilos. We are talking about morbid obesity. Obesity, morbidity, the obesity that cause risk on your life by any sense, meaning of medical illnesses, your heart, your lungs, and everything. We are talking about 65 major illnesses associated with obesity. To make it more interesting, actually, is things that you cannot achieve it by normal way. Bariatric actually will take you up into that level, and meaning of it will correct what's ever been ruined inside your body, from organs, from medical illnesses, diabetes, hypertension. The problem we talk, if you take only one of these medical illnesses, you will get a lot of complication from each one single disease. And bariatric, it will help that. So basically, this effect, which we call the metabolic effect, and that's why we are called also metabolic surgeons, is basically because it changed all your metabolism. Your sleep apnea and snoring and all this would change in 2 to 3 days. This is not obesity related. This is 100% related to the hormonal adjustment in your body. So basically, it's a whole workup for your body, and it will bring you to an age that you passed it long time ago. We believe the more you gain weight, the shorter is your age. We are not talking you are living longer or shorter. We are talking about your metabolic age, or what you call real age. It's mean what is your physical performance at that age. Is basically, if you are in your 40s with that obesity, you are performing as somebody who is age maybe 60. Understand? So when we are doing that, we are bringing you back to your real age. So this is actually is a whole workup for your whole health minus medical illnesses.
Wow, I just learned so much just from listening to that part of your answer. Now, obviously, this sounds fantastic, but what is the actual success rate for bariatric surgery right here in Malaysia?
Okay, if we talk about it in meaning of weight reduction, let's say, for example, if you're talking about how much it does reduce from the weight, we are talking about weight per se, it does reduce between 70 to 80% of your extra weight. In general, with the help of our good dietitian there, we always achieve between 85 to 90% of extra weight. So literally, we are go back almost to your ideal weight. So I will say it is more than 95%, 97% actually the success rate of the weight control for in bariatric surgery.
So it's not just the surgery per se, it's actually the entire bariatric plan together with the nutrition as well.
Yes, and the lifestyle as well.
Right. Now, I've been reading up a lot about bariatric surgery to prepare for tonight's session, and I came across so much information. It's a bit of an overload, really. And a lot of the information is both positive and negative, and I can't really verify it. So since you're here tonight with us, Dr. Mustafa, I want to ask you, what are the common myths and misconceptions about bariatric surgery, and can you straighten them out for us once and for all?
All right. People, they think is, okay, let's say, for example, they try and they try and try for them to lose weight, regardless whatever they have from that extra weight. Now, when they come to the level, they said, okay, that's it. I give up. Is a solution. Now, some people, they think that bariatric surgery, might as well just do bariatric. There is no shortcut. This is not a shortcut. Now, some people, they said, okay, why you want to cut your stomach? Why you want to go to a surgery? But you have to understand that obesity, it may kill you one day. We have to outweigh between the risk and the benefit there. Now, if you talk about the risk of the surgery in the hands of a skillful surgeon, it is even safer than doing an appendectomy, removal of your appendix. This is how safe is the surgery. Now, this is some people are skeptical about it. Some people, they are in their denial. Some people are against the idea of it. Some people, they're scared from doing a surgery. It's just a matter, come on, it's just a matter of weight. Why should I go for surgery? It's just because, we're not talking about major surgery. It's a laparoscopic surgery, it's a keyhole surgery. You do a surgery today, tomorrow you'll be at home. So basically, is no shortcut here. So the one thing that you have to understand, we are not just making because you are lazy to lose weight by the normal way, then you have to do bariatric. No way. If you are lazy, we are not going to do a surgery for you, because you have to follow the diet, you have to follow the exercise, you have to maintain your weight. Everybody, if you want to maintain your weight, you have to work for that. So basically, one of the things actually people, they are skeptical about it because they think it's a shortcut. It's never been a shortcut. Every person who has come to the surgery, they have to be qualified. I did 6 surgeries today, 6 patients, they have 6 major problems. And all these problems, all of them, almost 100%, they are curable. From diabetes, from hypertension, from the sleep apnea, from the fatty liver, and so on. So basically, I'm not talking about the infertility, which is all with the woman, with how struggling to achieve babies and so forth. So we have to look for the positive part of it. It's not about bariatric is not meant to be for weight loss surgery only. It is a medical illness, disease resolution for those obese people, and let's consider weight loss is just a bonus.
Right. So how do I know if I'm suited for bariatric surgery? Say I'm 15 to 20 kilos over my best, my proper weight. Would I be suitable for that surgery? How would I know?
Okay, we cannot take the weight as a single indication for you that you are qualified or no. So we take it in 2. Number 1 is the BMI. And the BMI, this is a calculation between your weight and height. And if you are obesity class 1 and class 2 and above, then you are qualified for it. if you are, unless you are obviously class 1, but you have some medical illness, I'm not going to go for the details, what is the numbers, but sometimes even obviously class 1, but they do have some medical illnesses that is actually need some sort of resolution. That's one indication. Second indication, sometimes you have something we call it what we call central obesity. What is this? When we measure the waist to the hip ratio, how big our waist to the size of our hips. And why is that? This will reflect actually these type of people when the ratio is very high. It's just to tell that those people, they have very big belly, which is, in some people they call it prosperity, okay? That's not prosperity. That is actually a central obesity, and that is the killer. So obesity, we divide into two, central obesity and global obesity. So central obesity even higher. We can find people that are 150, 200 kilo, they don't have medical illnesses. But some people, they have maybe a weight of 90 kilo, but everything is confined to the belly. Those people, they have a lot of medical illnesses. In too short, BMI and the waist to the hip ratio, these are the two main indications. And of course, if you do have on the top of that some medical illnesses, that make you super qualified for it.
Okay, so let's just say, I think I'm a great candidate for bariatric surgery and I want to know how to proceed. This might be a good time to bring in Karfu. I think this is where we need your input. From a dietary standpoint, what are the key considerations an individual should have before committing to bariatric surgery?
It's a very good question. Actually, honestly speaking, a lot of people, they may not think of doing nutrition preparation before the operation. Of course, we get to know that for those who have high BMI or high body mass index or high body weight, they require to prepare themselves well before the operation. The first reason is to ease the surgeon job. So the things that we're trying to achieve here is to try to help them to reduce a small amount of visceral fat, as well as to reduce a small amount of fatty liver. By achieving that, normally we require the client to go through a certain low-calorie diet or even a very low-calorie diet to bring down these two parameters. Imagine if the abdomen actually full of fat. For a surgeon to actually look into the stomach, to locate the stomach, can be quite challenging at some point. So by reducing some of the body fat, visceral fat, and also the liver fat, surely it will actually ease the job. So of course, we also need to look into the second objective, where we get to know when we help them to reduce a very small amount of body weight, it will also improve their the metabolic health and hence reduce the surgical complication later on. But one last thing that a lot of people they may not have think of is that because after going through the bariatric surgery, they will need to go through a very strict dietary plan, where we are a bit concerned in terms of nutrition status of our client, malabsorption and so on may happen that we need to tackle off. So we hope that before they go through this surgery, they are pretty well established in terms of their nutrition intakes. So probably if we get to know in Malaysia, it's very high prevalence that people have lack of vitamin D in the body. We will need to supplement them with some supplements to make sure that they're optimized in terms of all these nutrition parameters. And hence, when their nutrition status is good, when they go through this process, not just we say that we can predict more successful bariatric surgery outcome, we're also looking into they are able to cope through with a very good nutrition status, and hence we basically at the end is to enhance the surgical outcome, is to improve their health in general. So all in all, if to conclude how we are going to prepare for clients who go through bariatric surgery, beforehand, we will put them into a very low-calorie diet or low-calorie diet to achieve some minor weight reduction. But at the end, what we are trying to achieve is to reduce the visceral fat or to reduce the liver fat. They don't need to reduce 10 kilo or 20 kilo. At some point, we get to know that even they reduce 5% from the initial weight, it's already show all the benefits from it.
And that's just before the surgery. So
Exactly.
I remember Dr. Mustafa saying just a short while earlier that it also continues after the surgery.
Yes.
Is that
so
right?
The preparation, basically, it just need to take about 2 to 6 weeks. But now we get to know even 2 weeks already show a significant improvement, or with a minor weight reduction in just that 2 weeks is good enough to enhance the surgical outcome or the benefits later on.
Okay, fantastic. Now, I'd like to just jump back to Dr. Mustafa. I'll come back to you in a short while, Kafu. Now, Dr. Mus, how should patients prepare themselves mentally and physically for surgery? Kafu's already said they actually have to go through a dietary program beforehand. But what about the mental and the other physical preparations?
That's a very good question. And I think this is something we do it silently when we talk to the patient. Now, people, when they come to the idea that they said, okay, let's say, for example, very common habit, people before do bariatric, the night of the bariatric, they will skip maybe even and go and eat very heavy food, as if this is the last meal in their life. Okay, guys, just take it easy, okay? It's never been that scenario. Now, eventually, after bariatric surgery, you're gonna eat anything you like to eat. But what will happen is, you will be, maybe you will hate certain type of food and you like certain type of food. And I think after a while, Chef Bob, maybe he can experience his life and how the changes. Certain type of food, he cannot eat it or whatsoever. But if we talk about mentally, you have to understand now, when we talk about our body, everything is come from this hormone ghrelin. That hormone ghrelin is come from the stomach, and where the stomach is empty or overstretched, it will act. So when it is empty, you give signal to the brain, and the brain start to, then you eat, then when it is over, then it gives a negative signal, then the brain will stop. Now, in people who are overeater, that hormone overriding the brain, okay? So that's why it is over controlling. Now, all of a sudden, when you are gonna take it out from the body, so you have totally different control. Okay, just give you an example. Some people, they shiver when they see certain type of food. They want to eat it because this is their favorite food. Maybe you see after surgery, okay, that's fine. You will have this type of control. So the mentally, you don't expect yourself, you are gonna 100% you have to control yourself. No, the control is come from inside. So that's when we said the idea how you feel about the hunger or satisfaction of food is totally different. But also our patient, that what they have to understand, and this is, I think, most of the time, Kafu, he struggled with it more because the early time after surgery, they are under his care. So basically, it's the idea that you are from eating everything to be in a liquid diet, and from the liquid to the, what we call puree, to the soft diet, to the normal. So there are some stages that you have to pass through. You have to understand, you have to be prepared. But the bonus will come after your first 1 week or 2 weeks, when you start to feel your sleeping is different, you start to lose weight, you can move more actively. Food will be secondary. So we have to understand one thing here. Whatever we earn and gain from the weight, from the food, is actually the obesity. And that obesity turned to be a morbidity to ourselves. So how to go out of this? We have to be prepared. Okay, it's the time for me to stop this. I need to start a new life. If we do have a girl in her young age and she came with her mother, I will ask her mother to stay away. I need to counsel the girl. I have to make sure there is no pushing factor there. Why? We must have some something, a power inside over that. We want to do that. Whoever, those people, they decided in one time of their life is enough, those people, they never struggle. And that's why is actually, we do have some sort of indirect psychological assessment for those type of people to make sure they are prepared for that. Of course, those people who do have some psychological problem, those people, they have to go for a special assessment by psychiatrists and so forth.
Right, so basically we have to prepare ourselves that our relationship with food and our body is going to be different afterwards. And let's just say we've prepared ourselves for that. We've prepared ourselves physically, we've prepared ourselves mentally for bariatric surgery, and I'm ready. Nevertheless, it is a surgery, and like all surgeries, there are pros and cons. So Dr. Mohd, how do you manage your patients' expectations, and why is it important to set the right expectations?
Okay, this is a very good question, but it is a very wide question, because the expectations, a lot of patients, they will change from stage to stage. Okay, so a lot of them, when they come to you, some of them, they have, they get tired of getting too many medication. They want to get rid of all these medical illnesses. Some of them, they get rid of the weight. Some of our Muslim patients, they have difficulty in the prayers. Some of them, they have husband and wife, they can't sleep in one room because the husband is snoring like a machine. It's embarrassing, you know. So you have to understand those people in culture, they have a lot of social difficulties, and no one can understand that unless you have to talk to them personally. And most of those people, they don't reveal. But we doctors, we can hear these stories. I don't think this is open to public. Maybe other people, they can share. Some of the patients, they are very open. They can really share and talk freely about it. Now, each single person, they have all this, we will meet all this expectation in a time when it has come to weight and medical illnesses. It's very clear. But no false promises. Because if you, let's say, for example, if you talk about diabetes, the cure rate is around 80 to 84%, versus if you are talking about bronchial asthma and sleep apnea, you are talking about 94 to 96%. If you're talking about anxiety, you have an improvement between 60 to 70%. Panic attacks have a psychological problem. So each one of these actually have. We don't give, okay, don't worry, you do this 100%, everything go off. No, we give them the scenario on it, including even the type of pain they will experience after surgery, the type of food and everything. They have to understand that very well. But nowadays, and thanks to the social media as well, our patients, they are very educated and they know very well. Up to the level, rarely we can get patients who ask a question before surgery, because we do have an explanation, everything A to Z. But after that, do you have any questions? They already clear mind. And I think one of the big leaders is Chef Bob, because this fella, he dedicated his life to this. And thanks to him and the people like him, they are sharing all the experience, because we talk science, we talk, our words very dry, no emotions in that. And I know very of my patients, they don't ask me questions. They go and ask somebody like Chef Bob, because they have a different emotional reaction. And we are happy. Chef Bob also comes sometimes, he asks me questions, scientific question. I thought, why you ask me this question? Because he said, oh, patient asked me like that. And we learn from our patient actually how to go around it. No false promises, just need to tell them bariatric surgery is not about shortcut. Bariatric surgery is a transformation in your life. But if you don't have the dedication for it, if you don't have the motivation for it, we tell you, don't go for it. You must have some steam from that.
But I'm sure, Dr. Mus, regardless of all of the education you've given the patient beforehand, sometimes you will deal with patients who really do have unrealistic expectations, no matter how you have briefed them beforehand. Now, if they go into it with those unrealistic expectations, how might that possibly impact the post-operation follow-up?
Yeah, definitely. I don't think we face that in reality. There be some sort of, for certain type of patient, for some frustrations, because if they do compare themselves to others, why this person lost 10 kilos, I lost only like 7 kilos or whatever. We follow percentage here, and our weight loss plan is over 18 months. We are talking about 1.5 years. But because they are so eager, and you will never believe how they actually they change from their expectation. If you are talking about expectation, they come from the first, they just want to release their illnesses whatsoever. All of a sudden, 2 to 3 months, they are out of diabetes, hypertension. Now we are a game of weight loss. Then they said, okay, I don't want to go. Sometimes they nego, I want to lose even more, and so on. But the matter of frustration, I don't think we face a patient who is like, let's say, for example, meaning of aggressiveness, or meaning of like they get down or something like that, because they will know actually exactly how much they have to lose and how much they want to lose. If they are good enough, then they will even lose more than whatever the surgery meant to be. We do have people, even they lost 100% weight loss. We have people, they lost 110%. That's mean even below ideal. And this is where we achieve or try for those, especially the youngster, the girls who are not married, don't have any pregnancies before. We try to give them some safe margin for them for the future. So even if they gain weight, they are still within the ideal weight. I believe as long you are very frank to the patient, as long you give them exactly what they expect in a minute, there shouldn't be a false promise. Okay, this is what you mentioned. I'll give you an example. For example, those people who are super obese, there are different types of surgery. Sometimes they already in their mind, oh, I want to do a surgery like my friend. Come on, but this surgery doesn't fit you. Then it doesn't achieve that amount of, you have to do this stuff between, let's say, for example, CF or bypass or something. But and after a time, after 1 year, they say, well, so they cannot achieve their weight. See, I told you why you should actually follow this type of surgery. Yeah, of course, it will be difficult to convince the patient to go for a second surgery or change the type. But yes, I mean, we don't have hand in that, because sometimes the social media even stronger than the science itself, which is true, and you know that very well. But sometimes we have to follow their ways as well.
Dr. Mohd, have you ever had a situation in which the surgery didn't turn out as successful as you hoped, where the patient comes in complaining that they haven't had these success rates that you've seen other people have? And how did you deal with that?
Not really, but if you tell me, there is a condition, we call it in our term recidivism, is very difficult to pronounce, but it's actually in a matter of what we call weight regain. That will be when we are talking, because we've been doing this for quite some time. So we have patients who achieve their target, and then when they have what we call weight regain, there is actually where is the fact we have to redo everything back, but not surgery. We do always in a matter of, because the surgery is actually, if it fails, is first of all patient, second is actually the surgeon, because sometimes also the way how we cut and everything is depend on the experience alone. Here is actually the quality of cutting is also very important. But most of the time is actually is a diet program. Most of the diet, so that, and even careful, sometimes I have patients who have 2 years or 3 years, they have gained like 5 to 6 kilos. I don't bother. He have to filter them out, because he can go into details of it. Will be always food, is always food. Then sometimes we tell the patient, your plan, let's say, for example, over 1 year, 6 month patient, you see yourself, you already lost 30 kilo, 35 kilo, 40 kilo. That's not enough for that person per se. So you have to look for long term. If we have a very good long term, that's why weight loss is a weight loss and maintenance. Now the maintenance is also very important. That's why we emphasize on the follow-up, very important.
Right. So that brings us back to Karfu, okay? Because he's going to share with us some very important post-surgery advice. Now, I want to talk to you, Karfu, about some of the other claims I've heard, okay? Some say they've had a change in palate after bariatric surgery, as in they no longer have the same taste or appetite for foods they once loved. How would you advise your patients on managing that?
Let me try to summarize, because to talk about post-op surgery diet can actually take hours to finish it. But in short, it's just we get to know that whenever they do any surgery to our GI tract or our stomach or even colon, so they have immediate dietary change required just to accommodate to the discomfort at that moment in time. So we get to know that, for example, some surgery, sleeve gastrectomy, is to remove about 70 to 80% of our stomach volume. So right after operation, most of the time, our client will get early satiety or early fullness, that kind of pressure happen to them. So this is where that we have a different phases of diet for our client to follow, mainly because we want to ensure, first thing first, is to minimize any discomfort to the stomach. Number two, we have to ensure that with that discomfort, our client able to achieve the nutrition requirement, all right? And lastly, we only look into the weight as a target. But of course, now when we talk about weight management or obesity management, we have to look beyond body weight, okay? Because we know that at the end of the day, it's not the body weight that matters. Our objective is to improve one person's health, and the ultimate goal is to improve the quality of life of that person. So we go through the dietary plan. So we have a full liquid plan where our client required to go through, probably just to highlight, every institution will have different protocol to follow. So for the center that I'm working together with Dr. Mohd, so we have 1 week full liquid diet where our client required to go to receive meal replacement, okay, for a 1 week period. And that 1 week we also have to ensure that our client able to take enough water. Hydration is always the key priority in nutrition care. Second, we will look into the protein needs of a client. So as long as they get enough meal replacement, then they should be able to achieve both, enhance the micronutrient, vitamins, and mineral. So the second mix, there's where that we will actually allow our client to start taking up some food. And again, when it comes to second wave, where it says allowed to take a bit of food, doesn't mean that they're going to have freedom to have everything, because the feeling of discomfort may not disappear immediately. So some food will actually help them to, to manage the boredom of the shake and so on. So the food that we normally suggest is either yogurt or tofu in a very soft texture in a specific amount, complemented with the complementary to the protein shake along. Then later on, come to third week and fourth week, this is where that we will need our client to test on quite a variety of food, which include high protein food, fruits and vegetables in a very soft texture and in certain quantity, for them to again to reintroduce the food to the stomach, to let the stomach to get used to the food. So again, during this trial period, protein shake I will emphasize quite a lot, because liquid is always easier for my client to get through it. And once they're able to accept the solid food or soft diet quite well, then later on, we call the weaning process may happen. So this is where they slowly increase the soft diet amount and slowly reduce the protein shake. So this is where we hope that one day we're able to wean them off from the meal replacement. Now again, for the meal replacement or for the protein shake, they don't have to completely to remove it. Some of my clients, they find that taking protein shake is something that's very convenient, because imagine if your stomach is now getting sensitive to the portion of food or the types of food, and you need to work and different shift, and you're going to work in outstation, very hard to get food options. Sometimes meal replacement will come in very helpful in this way, because we know that when they're taking liquid, it's easier. And then if you're using protein shake or meal replacement, we also know that they're going to fulfill their nutrition requirement much easier. So all this process, it may actually take 6 months or even 1 year to get themselves to be ready or return to the normal diet. All right, or some they're actually still using some meal replacement, what we call as a partial meal replacement to their usual diet. So along a journey, for sure, they will have up and down. All right, because I mean, we are adult, we have been tasting so much of good food. Suddenly, they have a change along. We will expect some lapse or relapse happen. So this is where that we always encourage our client to reach out to us if they find any difficulties or they find that the lifestyle become miserable. So just to have an open conversation with us, because sometimes we go through this process, we just have to remind them they are not alone. The support is given. So again, they will have a support group. So they have a WhatsApp group for them to reach to us or to the members. So I guess going through the whole journey of bariatric after operation is going to be something that's lifelong. It's not something that's going to be short term. So always reach out for support and help.
I can see now why that mental preparation and the psychological assessment is completely necessary going into this, because there really is a lot that you have to prepare yourself for after the surgery. Now, one big challenge is actually just around the corner, Ramadan. I'm sure many of those listening in might be keen to know if one can still undergo bariatric surgery during bulan puasa.
Yeah, I guess lately I also received quite a lot of questions about Ramadan. So how should I going to do this after this operation and so on and so forth. But honestly speaking, by consensus, we actually kind of know that to do fasting is kind of challenging in the first year after operation, because we know that during Ramadan, they will have a restricted time for eating as well as drinking. So as I mentioned, the key priority here is to get enough hydration. So if they already have time to consume enough liquid, so and hence we pose them a very high risk of dehydration. So by consensus, the first year is a bit challenging. And we also hear from the member is that first year they just cannot go through fasting. So they will have to replace it for next year, or they will have to pay as a compensation in such a way. So of course, there are still members that are still keen to go through Ramadan. Of course, we will actually give respect. Where my suggestion will always given to them is that try to make good use of meal replacement, because if they get enough meal replacement, basically it will fulfill their hydration, the water intake. They also will fulfill most of the nutrition requirement too. And again, when I say that to try on Ramadan, it's always good for them to try it earlier, probably just 2 to 3 days to try it out, to see whether they're able to cope with the process, to see also whether there's any sign of dehydration, the sign of low blood sugar causing a lot of other illnesses and so on. So if all those signs and symptoms appears, it's going to impair their health. So we have no choice to advise them to break the fast, and probably this year is not a good timing for them to do fasting. So a lot of discussion along the way. So of course, I myself, we will actually value collaboration with our client, because the advice given can be very textbook. So we need the input from the client to make it personalized, and how well we can actually work around it. So if Ramadan can work it out, so we actually continue to support our client going through the Ramadan. It so happened that unfortunately the client just unable to get through Ramadan to practice fasting, then we have no choice. We just have to have an open conversation with our client to say, probably this year is not a good timing yet. Of course, at the bottom line, as long as they're healthy, there are many years for them to practice Ramadan fasting too. So the bottom line is always the health is the priority of in our care.
Right now, I'm sure many of those listening in have also been eagerly waiting to hear about Chef Bob's own experience with bariatric surgery. Thank you, Carfu. We'll come back to you in a bit. Now, Chef Bob, I've seen your recent photos. You look amazing. I can hardly believe it's the same person. And now listening to Dr. Mus and Carfu, we know that it's actually been a process of discipline and a lot of mental and physical strength from you as well. Could you share, Chef, what exactly was it that motivated you to go for bariatric surgery?
Okay, hi Sheahnee, how are you?
Good, thank you.
Okay, actually, this was the only hope that I can live normal as a life. Okay, I never been as this much weight before. Okay, I started my weight since small, more than 100 kilo over, and this was my achievement actually for myself. But I did it because of my health issue. I have very several health issue. They make me suffer, and I present myself for 3 years. Even I lost my job, I lost my everything. It take me and demotivate, lost hopes, and it doesn't make me feel happy at all. Okay, so this is the only that I think. At first, even myself, I didn't believe it will be happen. I just take a chance, okay, in case that it might be changed. But actually, yeah, it made it. I lost 112 kilo already. And that is not a really big issue for me. But my point is that I lost all my illness that suffered me too much. And now I enjoy so much, and I be a normal and be back.
Alhamdulillah, I'm so glad to hear that your health complications are dealt with. May I just ask very quickly, what was your starting weight going into bariatric surgery?
Okay, my starting weight was 173 kilo.
Wow.
Okay.
How about now?
Now I want around 61. Sometimes it can go to 60. It depends. Sometimes 59. Sometimes when I cheat a bit, it go up to 62. Okay. But still, I'm on that weight. Doesn't go anywhere. And my body are more lighter. Okay. Even I can enjoy now riding my motorbike, my car. Even I start to cook, and I'm active and happy back. And I enjoy everything, my life now. I feel that if I know bariatric surgery 20 years ago, I might doing it again. And maybe I'll be a surgeon. Who knows?
Well done. I mean, that's a fantastic achievement. And as Dr. Mus said earlier, it's not so much about the number on the scale, but more of the quality of the life that you get after that. Now, I know you can't share where you did your surgery, but can you share what were your key considerations for choosing your surgeon and for where you did your surgery? What were the things that you were looking at when you were searching for your surgeon and for the center that you did it at?
Okay, the first is the brand itself. Okay, because I study about the brand, everything, and I study about the procedure, and I study from the people itself. Okay, I study the surgeon. Okay, I study about bariatric, I think more than 1.5 years before I make my decision. because is it true? Okay, is it just a word of mouth? Okay, because and then I start to join Bariatric forum in US, in UK, in Arabs. Okay, and they encourage me so much. So and then I do check and I do meet most of bariatric patient and bariatric surgeon in Malaysia, but I don't know why, because I'm stick to that one only particular surgeon. Okay, because it maybe the surgeon itself feel want to help me, because I was the severe case. My case is quite very serious. Anything can be happen to me, because I'm the only one that I know. Okay, I'm using Ilazarov, or this I call it Educator in my ankle. Okay, so I'm bringing the first fixator Ilazarov in the OT room, and it's quite dangerous, and it's quite not really all the surgeons were willing to do it. So that's one of the consideration. The brave of that surgeon itself may play important role actually.
And we can see that the choice of surgeon and the center that you choose is important, because from what Dr. Mus and Kafu were sharing earlier, this is going to be a long-term relationship that you have with your dietitian and your surgeon. Yes?
Yes.
Yeah. Now,
Yeah.
this is something I really want to ask you, Chef Bob. What are some of the challenges that you have faced with the change in lifestyle or diet after your surgery?
Okay, in terms of food, yeah. Okay, I enjoy food around this. Yeah, I enjoy everything, but not as much as before. Okay, like before, if I go to McDonald's drive-through, I can order, and before before I left McDonald's, I can finish one whole meal. Okay, value meal done. But now, it takes time. Okay, it takes time. When I just take my from the center, and then just I need to eat it slowly. Okay, I need to take it time. Okay, actually it's good, because last time I didn't enjoy my food because I really to eat fast. Okay, but now I enjoy every bits of the ingredients, every bits of taste bud. Okay, even after operation, my sense of tongue and my sense of nose, are more 2 times double higher, and I can smell 3 blocks from my home who cook curry in my area.
Dahsyat tu.
Memang kan. But it trigger me, but that one also a bit dangerous lah, because you keep to lapar already lah.
Now, after your surgery, knowing now, what was the recovery phase like? After listening to everything Kafu said, you have to go through the liquid diet and then the meal replacement. What was that like for you, who loved food so much before that?
Okay, I'll be honest, in the first phase, we call it phase 1, that will be a bit tough lah, but we don't really have appetite on food that much, because last time if we tak makan, we'll get angry. Okay, we get angry, we get emotion, we get bad mood. But now, I can just, if you bring me along to the buffet center, I just can have a look and smile only. It doesn't trigger me at all. And then the only thing that problem with me is that my appetite, okay, I nak makan semua. Okay, I nak makan semua. Yeah, I will order every single thing. But the mangsa is my wife lah. Again, I will put okay, I cannot eat at all. So I will pass her around, and then she will be mumbling. And even sometimes we also get quarrel because I'm putting all the food to her. And then she are complaining that maybe she need to do also soon.
Alamak. Now, Chef Bob, I'm sure when people first saw you after the surgery and then with this dramatic weight loss, did you face any difficulty in facing the public? Did you get negative comments? And if you did, how did you overcome that?
Okay, yeah, actually, yes. It takes time a bit lah. Okay, it's not that easy, because people look at me as a big fat. Okay, even my name is Bob, big old boys. Yeah, so they sometimes they spectacle, they thought I'm maybe in Malay people we call it santau, right? They thought me I'm getting santau already. They thought I'm taking some other drugs or thing. because I lost weight drastically. In 2 years' time, I lost about 112 kilo. And it really make it different. Okay, even at the first, when my weight lost to 58 kilo, my face all down, you know, and then it looked like people who sakit lah. Macam orang kena santau, orang cakap kan. Just almost like that. It's not easy. Even my friend till now can even meet me or speak to me like before, because he seemed that he's talking to different person. He's talking to different person. But still, even my physical are different, but my heart and my funny and my humor are still the same. But still, not really all can accept it.
When you explain to them that your weight loss was not the result of santau or other reasons, but a result of bariatric surgery, what was the response from them like?
Okay, that was a good one, because they know that I suffer from my gout, my diabetes, my every single thing. You can just name it, all my illness. So they know that I'm suffer, and I present myself. I don't want to meet anyone for that 3 years. I hate to meet people, because people keep asking me why did I fat, why did I this, why did I that. I hate that. And then when they know that I achieve, my family was the very strongest backup plan, because they know that now I'm happy and I'm back as usual. Even my mom and my dad still can't believe that I'm like before in the family, I'm the most fattest and the biggest at all. Now I'm the smallest from all my family. Even my father is so bigger than me. But it takes time. Okay, it takes really times. Yeah, but to be, just don't look it on your, the physical, but or kilo. Look it on more to like illness thing. Yeah, it really helped me so much. Even now, yeah. But before, when I'm in 173 kilo, when I talk like this, or I give a lecture, I will sleep in the middle because my OSA are really worse. Even I can drive, I can involve in accident anytime. But now, okay, like I'm talking right now, okay, it's smooth. Yeah, I never have like before. Now I'm okay. Okay, I'm cool. Yeah, you can ask me to talk until tomorrow morning also, no problem.
I would love to hear more about your story, honestly, and I'm very sure that so many others listening in would love to hear more. Yes. Unfortunately, we're running out of time. So I'm just going to ask one more question from you, okay, Chef Bob? Okay. I think a lot of people listening in might be really interested to know, how did you fund the surgery? I mean, maklumlah kita ni artists, you know, yes. It's not easy to fund this kind of surgery. What options are available out there?
Okay, in my time, I'm using my EPF account too.
Okay, so would you be able to run through how did you apply?
Okay, the process is quite easy. You just prepare the IC, the statement, and then after that you just prepare the document, and all hospital will do it for you directly, easy. And then it will be, and then that's you did your operation. By tomorrow, okay, they will bring you to the nearest EPF. Somewhere in Jalan, my time is in KL. Okay, and then just go and thumbprint, then done. Even my family also were a bit like shocked, you know, because why? They thought that when I did my operation, and then they say you going to EPF after you did operation, but actually it's not that hard, you know, because when tomorrow morning when you wake up from the hospital, when you wake up from your bed, it's just nothing. Even I can do it myself. I can just be quiet, you know. I can come and do all my operation on Friday. Saturday, I just sleep one day. And then by Monday, I can go to work. Nobody know it.
Wow.
It doesn't feel pain at all. No pain. Serious, no pain.
Because it's a laparoscopic or keyhole surgery again.
Yes. I didn't feel any pain. Only just tipu lah kalau tak sakit sangat. Okay. But only when you wake up, a bit bloated. Okay, but that's why you need a homework, you need a support group, you need a people that buddy. That's why I always try to inspire and help for the new world. I receive every day mostly 70 to 80 calls. Okay, even my surgeon told me I can be a second clinic to him. Okay, because even my clinic are more, I think, more busy than my surgeon clinic. Because people keep asking me, but I'm glad and I want to help them, because I don't want people, because I know when my time, okay, I always disturb my surgeon. Okay, so I want to share back and help back. Okay, even I can help my surgeon lah, not to be so busy. I want him to concentrate on the OT room rather than concentrate all this membawang thing. Better I'll go to that side lah. So at least that it was actually, to be honest, that I did this because it's my thank and my appreciation to that surgeon. Because why? Because he saved my life. He bring back, okay, and then he pulled me out from the deep hole that I never imagined. I think if I didn't did bariatric, I won't be here anymore. I think so.
Actually, that is true. And I'm very, very grateful, shukr, alhamdulillah, that you got out from that, you did the surgery, and with discipline, mental strength, physical strength, you have recovered, and now you look fantastic, Chef Bob. Thank you so much.
Thank you. You're welcome.
Congratulations. Congratulations.
Okay.
So as Chef Bob mentioned, obviously he used his EPF withdrawal to help fund his surgery, but there are other three main options for funding. That is, you can fund the surgery yourself, you can use EPF withdrawal. There's also another route, which is personal loans such as fintech. Let's hear from a former patient on his experience applying for fintech funding.
Okay, untuk bariatric surgery dari Dr. Mustafa, saya join program fintech, sangat mudah. Pertama sekali kita kena isi borang online dekat website untuk semakan kelayakan pinjaman. Kita kena letak amount pinjaman, gaji dan jangka masa pembayaran. Kemudian dalam beberapa minit mereka akan call dan beritahu tentang kelayakan dan semua detail tentang pinjaman, termasuk amount, interest dan juga bank. Mereka akan recommend bank yang mudah untuk luluskan pinjaman. Kemudian mereka akan meminta beberapa dokumen seperti slip gaji, bank statement dan juga surat latihan jawatan. Proses pinjaman mengambil masa dalam 1 hingga 2 minggu. Kemudian sekiranya pinjaman diluluskan, kita akan pergi ke bank dan sign agreement. Sangat mudah. Contohnya macam saya pinjam 30,000 untuk buat bariatric surgery. Saya bayaran bulanan lebih kurang dalam 600 dalam masa 5 tahun. Terpulang kepada individu untuk pilih jangka masa pembayaran. Lagi lama jangka masa pembayaran, lagi kurang bayaran bulanan. Semuanya tertakluk kepada bank. Itu sahaja. Terima kasih Dr. Mustafa dan juga fintech.
So now that we know how to apply for the funding, a quick question for Dr. Mustafa and Karfu. For anyone listening in out there who's seeking to renew their lives, get their lives back, like Chef Bob did with bariatric surgery, can you just take us step by step? What can they do first, starting from right now?
Okay, first of all, they have to approach us, and I think we are here not to advertise. Once the patient approach us, then this is the time actually we do have to do the medical counseling for them. Sometimes the patient, we divide them into two categories. One, I will involve Carrefour badly in that. One of them, I involve him lightly in that. And this is actually where actually we will have to do from the clinical consultation that we take a serious of. They have to do, once we see the patient is actually from the clinical assessment, they are fit for the surgery, and we set the date, and we have to set the date also before the surgery to do the blood test, ultrasound, and we have to do the COVID test. And those patients, all of them, they need to have an endoscopic examination. This is actually a surgeon preference. Some of the surgeons, they do it pre-hand, that before surgery. I myself, I do it during the surgery, because one of the things, because most of our patients that have this sleep apnea, to put them under sedation is not that easy. I prefer when we do a patient under general anesthesia. For those patients, some of them, because they do have a lot of medical illnesses or whatsoever, and there are 3 doctors maybe need to be involved in that. That will be endocrinologist, cardiologist, and the respiratory doctor when we have to do some sort of sleep study or echo study or to adjust their medication for. That will be selected case to case. Certain patient, when they are in the category of the super obesity whatsoever, this is where CAFO have to take them in a very what we call actually LCD and VLCD. This is what we call the low calorie diet and the very low calorie diet, because even if they lose between like amount of, I would say 8 kilo, 10 kilos, but performance wise, this will change a lot for them. And the subsequent, whatever type of patient that we do, our aim that the patient do the surgery today, tomorrow they can go home. So we don't do the surgery and we keep them in the hospital a long time ago. No, those patients who need to stay longer, no, we will take it longer before surgery. So their preparation will take longer time before surgery. In a term, all the patient, I'll say 99% of the patient, next day they will go home. And this is actually, maybe Kafo can share also for the preparation from the diet, because those people, they have to go into certain diet, what we call clean diet. He can share in that as well.
Thanks, Dr. Mus. I guess to continue what Dr. Mus had mentioned just now about the nutrition preparation, so about the VLCD and also the LCD. So the key here is that whenever we can actually implement the very low calorie diet, we definitely will do so, because surely our client able to achieve the best result out of it. So very low calorie diet also means that normally we try to allow our client to achieve a calorie range in 600 to 800 calories, with a certain range of protein, probably is in the 60 gram to 80 gram of protein. So often we actually will use, will work together with a client to select the right meal placement for our client to consume. So when we say it's a very low calorie diet, so in the sense that they're going to use the meal placement to replace most of their food. So often our client will take 3 to 4 times of meal placement in a day. Probably if they still consider to have something to chew on, so we actually will allow them to have very low calorie stack. Most of the time, it's actually leafy vegetables as an option for them to choose from. So of course, leafy vegetable per se is not just about salad. So we can actually make it quite fun. So some of our clients, they will actually prefer to make soup. Some of our clients will actually make some vegetable rolls. Sometimes our client will actually make a vegetable stick as a snack. So actually kind of variety of a recipe we can actually explore with our client when they go through a very low calorie diet. But at the end of the day, when they go through this phase of a very low calorie diet, it also give them a feel how is it going to be in the subsequent weeks after the surgery. If they are able to comply to, or if we get to know that by doing this very low calorie diet can help them to improve their weight a bit, we are able to predict later on how they are going to do it, how are they going to do in the subsequent weeks after the operation. So of course, from my end, I guess not just about the food I need to discuss with my client. I guess we also need to help our client to identify what is their long-term goal. Because as mentioned, obesity management is not only to look into the scale, the number in the scale. We need to know, we sometimes actually ask our client, what do they want to achieve if they get healthier? So what do they see themselves if they get healthier? They need to list it down, because those are become the key motivator to move them along the way, right? Because knowing the goal, knowing the success parameter, because the number is actually can be easy for us to put down. But what do they actually want to achieve at the end of the day is actually the key question in mind. This is where the individualization will comes in, and this is where they actually bring them much longer term. So I hope that 2 key things here, being a dietitian, where we look into the food. So before the op, they need to go through a very low calorie diet plan, and then to help them to establish what is their life goal is after the surgery and so on.
Dr. Mus, thank you, Kafu. Dr. Mus, at which stage, if someone wanted to apply for financing to fund the surgery, at which stage of that would they actually be needing to apply for that loan?
This have to be a pre-hand, as if when you want to buy a car, you have to get the approval from the bank. So it's basically is a personal loan. It's just that our job here to help them in the to guidance. You have to understand this personal loan things is actually to include bariatric in this fintech program. That was actually is a production of hard work with in collaboration with Johnson & Johnson for almost like 1 year to get the approval for the bank, in order to get this as a feasible program for the patient. Rafi is actually, as the patient mentioned in the audio recording, will take something within less than 2 weeks. And I believe nowadays, even the loans now they are very efficient. Even within days, you can get the approval. And basically, the program is only not 5 years. They have 1 year, they have 3 years, and they have 5 years, and they have extended 9 years as well. So, but it's all depend on the individual background as well. So this is actually, we have no hand in that because, bank, they don't accept third party. But we are the introducer because we signed the program and we designed the program according to whatever qualification and according to all the protocol of Bank Negara and the bank itself. So we get the access for them, but the subsequent things, everything between the person and the bank himself.
Thank you very much for clearing that up for us, Dr. Mus. So for those of you listening in, if you've been struggling with your weight and diet and exercise has proved fruitless, I hope you found tonight's session helpful in deciding what options you have available. And if funding is a concern for you, not to worry. There are so many finance options available right now, including self-funding your own search, your contact number, and the state that you're currently in, and get a call to you soon. Okay, now I'm sure you
No. Apologies, I think we've got a bit of technical glitch. We should be back shortly.
What's going on?
Maybe we could actually have some of the questions answered. Maybe we would like to start with you, Kafu. Do you have any of the questions that you'd like to answer from the audience?
Okay.
Okay. I think a lot of some of the questions that are actually asking about besides bariatric surgery, is there any other way that they can actually look into weight management per se? So probably I give an overview. Now, in obesity management, of course, we must actually recognize obesity as a chronic, complex, progressive, relapsing chronic disease. So it means that obesity is actually can be managed like diabetes. It should be managed like other chronic diseases like diabetes and hypertension. And hence, the treatment is actually most of the time require multi-modality as well as involve multidisciplinary team approach. Bariatric surgery is so by far we get to know that by research is the most effective treatment given for those who are with obesity. And we can also explore other pillars in the management. The foundation is always nutrition and physical activity as a foundation, and is further supported by a few pillars. So one is what we call behavior therapy. Nutrition and also physical activities to tell us what they should do in these two aspects. And behavior therapy is to look into how or why they should do this. And later on, it also has another pillar we call the pharmacotherapy, where medication is going to come in to help to cope with enhanced increase in terms of appetite and so on. And of course, last but not least, just now we have discussed quite a lot, which is a bariatric surgery. So when we look into management, it actually encompasses all this package of the treatment. So it depending on where our client is, and hence the treatment will be given accordingly. For sure, looking into all these modalities will be good to discuss with the doctors, and then the doctors will then will guide you to which treatment or which modality is going to be applied to that particular patient. So it doesn't mean that by doing to looking into bariatric alone without looking into nutrition and physical activity going to be effective. So all this must come into place, and we need all those modality to be in to help our client to manage their the weight and also obesity associated complications.
If you just allow me to add on whatever Kafo mentioned, sometimes we need to understand obesity. There are many causes for the obesity because of why the patient, because sometimes, like what Kafo tried to say, is actually something he needs to know why those patients, they are actually up to that level. So when the people, they said, okay, oh, this is actually kita berturunan, okay, kita tak percaya masalah berturunan. There is no such a thing. There is no one born obese, no one. There is no such a thing. If there is maybe some genetic disease, it will say maybe perform like less than 1% of all the obesity. Yes, possible. But if it is all come from your environment where you lived in, and you can watch in a family, their father, mother, kids, whatever, it's actually because they just share the same habit. And sometimes if you find it very difficult to follow what advice like Kafo is trying to give you here, sometimes you have to think of environmental changes. Change the place you meet, the friends, the type. We cannot change our job. But let's say, for example, all of them, they go to this good diet, maybe you have to change. You always meet with those friends who like sit and eating, or so maybe you have to meet with the friends who like to cycle and run and whatsoever. So it's very important, the environmental factor here, it will help a lot to really get benefit from the alternatives like Kafo tried to give you here. So sometimes the challenge, you cannot take it very personal because it's very tough and difficult, but you can ease it on yourself to change your surroundings. Bad or bad friends, don't make with friends who would like ask you to eat a lot. Go with the friends who ask you to exercise a lot. These are some modifications. Okay?
I fully agree to that. So to improve health, we need change. So we need to step out of the comfort zone.
Thank you so much for your answers, guys. I'm so sorry I dropped out just now. I don't know what happened, but I'm so glad to be back because I have so many questions for you. One of the questions actually is from Louis Xia. This question is for Dr. Mus. He's asking, is there any age limit for bariatric surgery?
Okay, thank you for the question, Louis. I think it's very good, vital questions. We follow the Ministry of Health here is between 18 to 65, 18 to 65. This is the qualified age to give a consent. Anything less than 18, that's have to be according to the family meeting and conference. We have to make sure that, because if, let's say, for example, even if they are in their adolescent age, but they have super obesity, we know we need to treat them before they go to major complication of this obesity. So that's had to be case by case basis. More than 65, this is actually, unless that obesity is actually life threatening, in meaning of, if you don't do the surgery, this obesity will kill that person. But if we do the surgery, that you may save the patient from dying from that medical illness whatsoever. I give you an example. There is some disease called Pickwickian syndrome. What is that Pickwickian? People, they cannot breathe because the muscles of the chest cannot go up and down because too much of fat. Those people, they reach to a certain limit, they cannot go up from the hospital because they have to depend on the oxygen and ventilators. Those people, if you don't do the surgery for them or make them lose weight, then they're gonna die because of the respiratory failure. So those people, regardless of the age, we've done on 79 years of age. That's one is actually an example. But back to the answer is 18 to 65.
I have another great question here. This one is anonymous, actually. And quite a few people are asking this question. What are the chances of patients regaining weight post-surgery?
Okay, now we go back to the same answer we answered just now. It is all about self-motivation. If you think that bariatric surgery will change your life alone, you are totally wrong. If you are not going to follow your diet, if you are just going to not buat surgery, goyang kaki, you are totally wrong. Okay, it's have to come from self-motivation, and you have to come from, okay, if you follow till you achieve the target that you set already with your doctor, then you have to go to what we call maintenance. Now, maintenance, the principle is very simple. It's a protein-based food, and it is a toning-based exercise. You need to build up muscles in your body. You need to make your body stronger. And even, let's say, for example,
Oh dear, I hope we have not lost Dr. Mus. All right, just in case we can't get Dr. Mus back, not to worry. We will try and get, yes, there you are.
Okay, if you are going to get like a 10 or 15 kilos, or say, for example, that is actually, most of the time is actually because of the diet. So let's make it like bariatric will take you from one category to another category, then put you in the category of the normal weight or near ideal weight. Then from there to take it for the rest of your life, that will be actually, will be your diet and the quality of life. Even I believe normal people also who have a normal weight, they have to really take care of their food. You ask, like, for example, Kafo, always, I don't know what type of protein diet he brings from all over the world. Every day have a different diet, but it's all healthy. That's why he can maintain like that. So it's actually all, it depends on the person as well.
Right, here's another question related to hormones. Earlier, Dr. Mus was sharing about how the surgery does actually change your hormones. So this question, anonymous question, is asking, will it reverse a patient's hormone imbalance, and how exactly does it impact the patient's hormones?
Okay, there are two effects from the surgery. One, we call it mechanical effect, one we call it physiological effect, or what we call metabolic effect. Now, let's say, for example, if you do have an extra weight, and because you have a knee joint pain because of that extra weight, it is weight related. So the more you lose weight, the more the pain will get less and so forth. But when we come to the metabolic effect, I'll give you an example. If the person who has snoring, the snoring will improve by, I would say, 50 to 60% in a matter of 2 to 3 days. How many kilos you can lose, 50 to 60%, how many kilos you can lose in 2 to 3 days after the surgery. That is actually not weight related. This we call it hormonal modification. And this is where the surgery is called metabolic effect. Now, when we change the size of the surgery, when the hormone go off, and when sometimes we take the small bowel, sambungan perut, usus kecil dengan perut, this all will change all the hormone secretions. And not only that, some of the hormone which is already been secreted in the usual way, the body will give a new job for those hormones. Or that hormone will be secreted in a certain amount, will be secreted in a different. There are many theories behind it, the foregut theory, hindgut theory. This is all very scientific things. It does change the function of this hormone. Let's say, for example, patient who have, let's say, for example, he have diabetes mellitus. He's on single medication. Tomorrow morning, today the surgery, tomorrow morning we stop the medication because it will secrete the GLT-1, which is in another term we call it insulin analog. So there are many, many things. And a female, because definitely, especially those people who are trying to achieve pregnancy and they have what we call PCOS, polycystic ovarian syndrome, basically because the fat itself is over secreting the estrogen, and this will go all their period haywire, and they are at risk of ovarian cancer, breast cancer, because too much of estrogen in their life is actually slowly the hormone will go and regulate back, and then when the amount of fat will go less, the amount of estrogen will go also back to normal, so the balance back again. So there are many ways to explain. I don't think we have enough time to explain, but this is what we call the metabolic effect of the surgery, which can start within 4 to 6 hours after surgery.
Unfortunately, we don't have a lot of time to take too many questions. I believe Dr. Mus also has to rush into complete other surgeries, if I'm not mistaken. So let's try and cover a couple more questions. Someone here is asking, what is the cost for the surgery? Total package, including dietitian, surgery, fees inclusive of the meal replacement and supplements. So maybe the long-term cost.
Okay. If we talk about surgery, let's take the sleeve gastrectomy as a package. I think this is, we can share it with everybody, is 29,000. This is a price we worked hard to bring it down up to that, is a package price. That includes all the blood tests, ultrasound, scope, the surgery, in and out, the dietitian. The follow-up actually is not included. The follow-up will be in a matter of 2 weeks, 2 months, 3 months, 3 months, 3 months. So 5 times in the first 1 year. Each time that it will cost around 100 ringgit, 105 ringgit. That will be the follow-up. No much of medication that we use after. Supplement they need to take, as Dr. Kafo, he mentioned just now, the supplement is quite reasonable, within 100 plus. That will be enough for 4 to 6 months. That's what they need. Of course, if we talk a different type of surgery like a bypass, is totally different cost because the surgery is longer, the barang to use is even more. That will be around 35,000 also as a package price.
All right, we have quite a lot of questions actually related to loose skin. Obviously, if you've lost as much weight as Chef Bob has lost, obviously they'd want to know, what do you do with the loose skin after all that weight loss?
Okay, for those people who basically depend on you remember what we mentioned just now about global obesity and central obesity. Those who are globally big, they will be globally get smaller, and they don't have much of loose skin. But of course, we cannot force, because this is depend on the body habitus. Those who have very big arms, those who have very big bellies, or sort of if the amount that we start within 2 weeks, we start to them very early toning exercise. We advise on exercise, a bit of simple weightlifting that will help to tone up all the muscles. But nevertheless, if those who have actually a very loose skin, then this is a time when we have to ask the help from our plastic colleagues. Then they have to do some sort of plastic surgery. It's very dependent on the amount of weight. The more the weight, the more they are into that category. Sometimes just a matter of a small amount, they need a bit of liposuction, skin tone, but some of the patients, they will just get used on it and they can just go with it within the normal clothes. Some of them, their body will shrink back. So that's why we don't ask the patient to think about it till 18 months, where their body is more stabilized and shaped up.
Okay, I think maybe we'll just try to take a couple more questions. What about cases in which a patient is keen to do bariatric surgery, but it is not recommended because they have other conditions, for example, a heart condition? What kind of options would they have?
Okay, I will talk from my side. If we do have cases, unless those people who have actually some sort of heart failure, but the person to tell they are fit or not fit is not us, is the cardiologist. This is where actually we ask our cardiologist to give the green light, yes or no. We call it the risk stratification. Those people who really they cannot, we do have some sort of alternative medications. We have endoscopic procedure, like what we call endoscopic balloons. And nowadays they have even the balloon they can swallow actually that can restrict the stomach. But we know the effect of this is actually only for a period of time. But if you do some sort of this mechanical intervention or medical, what we call pharmacological, and you have a very good diet, because most of those patients, when they come even to do endoscopy or we have to give them medication, they must go and see Kafo, because he have to guide them up accordingly. And if you just let the patient is okay, you just go and follow, they will never follow. They must have a proper program. Then the way this actually they will follow. Then from there is actually and I believe also Kafo will be a bit lenient with them. We don't give a very strict time in a very short period of time. No, you have to give them a bit of, they will get bored if you give this one cannot, this one cannot, this one cannot. You have to be on and off with them. Then they can achieve more. Maybe Kafo can add some more.
Yes, Kafo, please do.
Yeah. I agree on that. So again, just now we mentioned nutrition and physical activity is always the foundation in obesity management. So we also need to look into the behavioral therapy aspect. So this is where that we need to work with them behaviorally to help them to figure out. So what do they try to achieve? What's their life goal like? Because they need to identify the motivator to move them forward, to also help them to sustain the long-term plan too. So of course, it's just not to tell our clients that every day you're going to eat clean. So we need to work out with our client at what point they can actually still enjoy their food, in what certain amount, at what time, because we know that somehow a free meal, it can be pre-planned. They can still enjoy the usual diet that they can have, as long as you're able to have an open conversation. What do they like to enjoy? How we can actually move along with those deviation, and how we can actually bring them back to the right track, and hence they actually will move forward accordingly. And surely, as Dr. Moose mentioned, if they come in with a different complication, we'll actually manage them accordingly. Surely, Dr. Moose will then help them to stratify which one will come to priority, and then I'll work closely with Dr. Moose what are the things that we need to look after first. Then from there, we'll move along. So this way that communication with our client required, and a lot of close communication between the surgeon, the dietitian, the nurses, as well as the patient as a core. So then we will actually able to give them an individualized plan.
All right, I'm just going to squeeze in one last question because we've had quite a lot of people asking the same thing. What common complications or side effects can a patient expect going into bariatric surgery?
I will rather say surgery per se, not much of complication because it's already is a safe surgery, and as we said, it's a laparoscopic surgery, even safer than doing an operation of removal of the appendix. Not much of people are thinking of, let's say, skin infection because the wounds are very small. I would rather than is actually we put it to more into main thing, which is malabsorptive. This is actually where they will have some difficulty in the absorption of the proteins, whatever, which we also is something very temporary. For different cases like bypass cases, they will have even more than that than compared to sleep. That's why the majority of the cases we do sleep, but we know very well sleep doesn't fit everybody. Another thing, sometimes they have what we call marginal ulcer that is more in bypass, but this is what we call long-term complication. And an early complication is a matter of the diet. People, they believe that is okay, you do the surgery, then you eat and vomit or whatever. That is actually not true at all. Is all, unless you want to eat and drink like before, never happen because your stomach is really smaller. So, but I will put it more into protein and diet deficiency, which will be not a clinical thing. That it doesn't appear other person like to be like he's a sick. No, it's just a matter of adaptation to them to adapt. For the female, maybe they will experience a bit of the hair to be thinner or even hair falling, but even that is actually will be just temporary thing, and they will adapt to it in a while. Then everything go back to normal.
All right, unfortunately, that was all the time we have for our questions. Thank you so much, Dr. Mus. Thank you, Kafu. Thank you, Chef Bob, for your candid questions. They've been very, very helpful and given me a lot to think about as well. So for all of you listening in, if you've left a question for us, not to worry, we will try and get back to those questions offline later on. Dr. Mus and Kafu have promised that they will try and answer them later on. So do check back on Facebook if you're listening in through Facebook to get your answers later. Now, if you've been struggling with your weight and diet and exercise has proved fruitless, I hope you found tonight's session helpful in deciding what your options are. As I shared earlier, if funding is a concern for you, not to worry. There are so many financing options available right now, including self-funding your surgery, EPF withdrawal, like what Chef Bob did, and of course, personal loans such as FinTech, which was shared by the audio testimonial earlier. And so if you are interested to get a consultation for yourself, it's very easy. All you need to do is just drop your name, your email address, your contact number, and do state the state that you are residing in currently, and a hospital will actually contact you soon. So it's really as easy as that. You can also feel free to drop that information even after the session is over. So I'd like to take this opportunity again to thank you to our panelists. Thank you to all of those tuning in from all over Malaysia for your interest in this session. And now I'd like to toss this session back to our host, Victor.
Thank you, Sheahnee, for moderating such an interesting discussion. And also thank you to our two expert panelists, Dr. Mustafa, Muhammad Taher, and Nkafu. Not forgetting our guest speaker, Chef Bob. I'm sure that our audience have a better understanding of obesity management, especially on bariatric surgery now. So before we end, please do help us complete the evaluation poll, which will appear on your screen right now. Okay, once again, thank you everyone for joining us tonight, and a big thank you to our education partner, Johnson & Johnson. For your information, we have a series of health education talks organized in partnership with Johnson & Johnson. So for our next webinars, we will be having it in June and July 2021. So do keep an eye out for them. And thank you very much. Stay safe and good night.